Reducing your sodium intake. Disclaimer: the information contained here should not be a substitute for the advice of a qualified licensed physician or other health providers. The information provided is for informational purposes only. Please check with your physician or healthcare provider with any questions or concerns. Sodium is a mineral that controls fluid balance and maintains blood volume and blood pressure. Consuming too much is linked to high blood pressure, stroke, heart disease, and kidney disease. Too much can also cause fluid retention. You might notice swelling in the feet, ankles, and/or hands. Weighing daily is important. Notify your doctor if you gain more than 3 pounds in 24 hours or 5 pounds in a week. The weight gain may be caused by fluid retention. Recommended goals for sodium. Per day between 1500 to 2000 milligrams is recommended. No more than 500 to 600 milligrams is recommended per meal. Per snack 100 to 150 milligrams is recommended. Reminder: 1 teaspoon of salt equals 2,400 milligrams of sodium, which is above the daily recommended goal. Foods high in sodium include processed foods, canned foods, condiments, pickled foods, seasoning mixes, salty snacks, and beverages. 77% of sodium in our diet comes from processed, packaged, and restaurant foods. Only 12% of sodium occurs naturally in foods. When reading food labels, make sure to check the serving size of the product, check the number of servings that are in the container, and find the amount of sodium that is listed on the food label. For this product, 1 serving size equals 2/3 cup. There are 8 servings in the container and the amount of sodium equals 160 milligrams per 2/3 cup. Tips for reducing your sodium intake. Get rid of the salt shaker. Eat more whole foods, foods that do not come in a package. Cook the majority of your food. Read food labels for all packaged foods. Choose frozen foods without sauces. Look for low sodium, no added salt, or unsalted on package labels. Look in the ingredient list on food labels for the words salt, sodium nitrate, nitrite, propionate, brine, monosodium glutamate, sodium bicarbonate or baking soda, and sodium sulfate. Seasoning food without adding salt. Use fresh or dried herbs and spices, fresh or powdered garlic and onions, lemon or lime juice, ginger, vinegars, salt-free seasoning blends such as Mrs. Dash. Salt substitutes. Most salt substitutes contain potassium chloride, which can interact with some diuretics and ACE inhibitors. If you need to limit your potassium, because of decreased kidney function or medications, you should not use salt substitutes with potassium. Try salt-free seasoning blends such as Mrs. Dash. Foods high in potassium can decrease the negative effects of sodium. If not on a restriction, include as much potassium-rich food as you can in your diet. A few examples of potassium-rich foods are bananas, mangoes, avocados, and oranges. See the list below for more examples. Tips for eating out or dining in. Look up the nutrition facts for sodium ahead of time. You can look online or on smartphone apps. Avoid salt shakers. Ask for restaurant meals to be prepared without added salt. Get sauces, salad dressings, condiments and gravies on the side and only use a small amount. Opt for protein, non-starchy vegetables, and starch without rubs and marinades versus mixed dishes.